Basically, the two types of pregnancy, right? So we have the medical procedure and then we have the surgical procedure. So with the medical one, it's usually done from 10 to 12 weeks of pregnancy or anything sooner. So what they do is there are two types of pills that you become given. So the first one basically just stops the progression of the pregnancy, any hormones that become released, any attachments, anything like that. So it stops that process. So it can take about 24 hours or up to 48 hours up until they're ready to give you the second one. So the second one can be administered vaginally as a suppository. And that one basically now is responsible for expelling whatever that's inside. So with that one, that's when you start experiencing cramping. That's when you start now bleeding because everything that's inside is now coming out. And that's where people also experience like clots in their blood. And then there's the surgical one. So this one happens from 12 weeks to 14 weeks. So this is where they use a suction, right? So that suction is inserted inside your vaginal canal up to your uterus, and then it dilates your uterus and then kind of like suctions the contents that are inside. So remember, when a person falls pregnant, the attachment that happens, there's a lining that has to be created, for that environment. So all of that becomes expelled. So usually it's done under local anesthesia or general anesthesia, depending on the person's weight or their tolerance thereof, or whatever dose that they'd be given. So it depends on their tolerance. And then, yeah, to feel as less pain as possible because it is quite invasive. Doesn't take too long, 5 to 10 minutes. So that's why it's important for a person to really go the medical route so that they can be able to, collect the correct history, also know your allergies and know which route to take between the two procedures.